Welcome back everybody to a brand new video on the Dentist Saad channel. My name is Future Dentist Saad and today we're going to be talking about one of my favorite subjects from third year, and that subject is drumroll, conservative dentistry. I just wanted to talk about what we've been through in conservative dentistry so far because I feel like it's some interesting stuff, and this is at the end of the day a dentistry channel. By the way, I will have all the timestamps right here, so if you want to jump around the video, be my guest, look around and yeah, have fun. So let's get into the first point. When we started the year, the first thing we did obviously is to learn the theory, because the theory is going to help in the practical. So the main theory that we needed to learn was the different types of caries. Now there are 6 types of caries that we need to know about. Class 1. These are caries that affect the occlusal surface of the posterior teeth and the lingual surface of the anterior teeth. The occlusal surface is also known as the biting surface. You know when you chew, the surface that actually touches the food and crushes it, that is also known as the occlusal surface. And the lingual surface is the surface of your teeth that touches the tongue. Class 2. These are caries that affect the proximal surfaces of your posterior teeth, meaning your molars and your premolars. Now what you might be asking, what is a proximal surface? Just in case you don't know, the proximal surface is a surface, you know when you floss between your teeth, that surface between two teeth is also known as the proximal surface, which can be mesial, which is closer to the midline of your face, or distal, which is further from the midline of your face. Class 3. These are caries that affect the proximal surfaces of the anterior teeth, remember that, not affecting the incisal edges. The incisal edge is once again, it's like the occlusal surface. It is the part of the tooth that actually touches and cuts the food. Class 4. These are caries that affect the proximal surfaces of your anterior teeth, including the incisal edge. So it's like class 3, but class 3 does not involve the incisal edge, whereas class 4 involves the incisal edge as well. Class 5. Now for class 5, we need to know what the gingival 1/3 means. Now in dentistry, we divide the crown of the tooth into 3 parts. The gingival third, which is the third of the tooth that is closest to the gums, the middle third, and then the occlusal third, which is closest to the occlusal surface of the teeth. So class 5 says that it is the caries on the gingival third, on the facial or lingual surface of any teeth. Class 6 caries. These are caries that affect the cusp tips of the canines, the premolars and the molars. Now we are done with the classification of caries, and we had learnt all of this and we had all of this knowledge in our head. Now the next thing is, what is a dentist's whole purpose of being there? It's not just to know that, oh yeah, this is a class 1, that is a class 2. We also have a purpose. We're supposed to do something with this knowledge. And what we did with this knowledge is we learned how to prepare teeth for obturation. Or in other words, how to give a person a filling. We practiced with both plastic and real extracted teeth. So for the plastic teeth, they were given to us by the university. But for the real teeth, we had to go around to the dentists around Plovdiv and ask them if they had any teeth lying around, or if they could give us any teeth that they extracted in the future. So what me and my friends did is we got a glass jar, we filled it with hydrogen peroxide, and we took it to dentists around town, gave them our contact details, and then we left it with the dentist for about a week or so, went back, and then we collected the jar which had teeth inside of it. What we did with these teeth is we dried them and then they were ready to use. So T, what are we doing?
Finding out bottles with hydrogen peroxide to get teeth.
We're walking around Plovdiv trying to get teeth from clinics
We're not putting this on YouTube.
with these jars. So, and it's raining, which doesn't help. And I've got my bike, which I have to carry around. So yeah, fun days. Didn't expect to be doing this in dentistry. So we've had to take shelter inside the dentist clinic because the rain's a bit too strong. Now, when you are going to all of these dentists around town, you are in Bulgaria at the end of the day. And this is when all the Bulgarian you've learned in first and second year, guys, I'm telling you, if you're still in first and second year, please focus on Bulgarian. It is really important. So this is when your Bulgarian comes into play, because most of the dentists are probably Bulgarian dentists, so they can't really speak a lot of English. So if you really know Bulgarian, you can communicate with them, you're going to get many more dentists saying, sure, I'll take your job for you, I'll fit open teeth for you. Whereas if you can't, you can still do it, you can use Google Translate, but it just takes so much longer and it's just such a hassle trying to pull out your phone and trying to understand what the person's saying to you. So just focus on Bulgarian and learn it, because this is just third year, and right now we're only talking to dentists and trying to get teeth from them, but next year we're going to have patients and we're going to have to deal with them. So I definitely recommend, if you are still in first or second year, learn your Bulgarian, focus on it, because they will definitely come in handy. But in the meantime, while we were waiting for our natural teeth to be extracted and for us to get those teeth to work on them, we worked on our plastic teeth, and here is what we did with those. For our plastic teeth, we used metal carbide burrs, whereas for the natural teeth, because they are much more harder, if you saw our facts video, we did say that the teeth are the hardest substance in the body. So for the natural teeth, we had to use a diamond burr. Yes, you heard that right. As we go along in this video and I start talking about the different types of teeth, I'll be cutting 2 clips of those teeth and what they actually look like as a final product. And if I can find any other clips of before I finished actually working on them, I'll put that up there as well. So be excited to see what's coming up. So it's time for us to start working on our plastic teeth. The first thing we had to do is preparations for an amalgam filling. Now you might be asking, what is amalgam? Amalgam is basically a mixture of liquid mercury and metal alloy, and when they combine together it makes a strong substance that can be used for fillings. This is actually what an amalgam filling looks like. But that is obviously once it is finished. When we start, it does not look like that. The main thing you need to know for amalgam preparations and creating them is amalgam, once it has set, is going to expand slightly. We can use this as an advantage in order to get fillings that will stay in place properly and that won't fall out. This is why when you do a preparation for an amalgam, we make sure that the walls of the preparation junction are convergent, because amalgam doesn't actually bond to the tooth on its own very strongly. So what we need to do is create this shape where when amalgam expands, it will properly fit into that shape, and then it's impossible for it to just fall out, and it stays in place for as long as possible. The different types of preparations we had to do for our amalgam fillings were the box type cavity, foramen cecum, the dovetail.
Now this maxillary second premolar, it is filled with amalgam, but I forgot to polish it because we didn't have enough time. So this is what amalgam looks like once it has set, but before it's been polished. You can see that it has a very rough surface, which if you scratch you can feel the roughness. Once it has been polished, it becomes smooth and shiny.
And the mesio-occlusal cavity.
This is the maxillary first molar with an amalgam preparation, and as you can see, the surface is much more shiny, glossy and smooth because it has been prepared and polished.
And we did pretty much the same thing on the natural teeth. In that same exercise, once we had collected one of the molars from the dentist, we had to perform a foramen cecum on the natural molar, and this is what that looked like. Type of preparation we had to do was preparation for anesthetic restorative materials such as metal cast restorations. We also practice a method that isn't used nowadays, but just for the mesio-occlusal distal preparation that we had done on one of the molars, what we had to do is we had to obtain an impression of the mesio-occlusal distal preparation that we had done and add a clip on top, which I guess in the past they would use to create a restoration using gypsum and casting it into metal and all the other sort of stuff. So we practiced that, although nowadays in dentistry it isn't really used. The next thing we did is we did a class 4 preparation. Remember we talked earlier about what a class 4 cavity is, involving the incisal edge and the proximal surfaces. Now that we had made a mesio-occlusal distal preparation on a plastic tooth, the next step was to make it on a natural tooth, which was for indirect composite in the future. This now brings us to the part in the syllabus where we started working with composite. The thing about composite preparations is that they have a strong bond with the tooth. So unlike amalgam, we do not need to create converging walls. In fact, we can have either straight walls or slightly divergent walls, meaning the walls go slightly outwards, but very, very slightly. If you can't do the very slightness, just keep the walls parallel and you're good to go for composite restorations. We now also created the preparation called form and cecum on a natural molar for future composite filling. Then we started working with plastic teeth again, where we did a class 4 preparation on indirect composite of the tooth 1, 2. 1, 2 also means the upper right lateral incisor. So we did a class 4 preparation on the natural incisor. Posted on my Instagram when I first did this because I was pretty proud of it. I can't lie. I mean, I worked pretty hard for it. The only thing that I regret is that at uni at that time we didn't have the correct color for the tooth, so the colors come out a little bit weird. But I know if I had the right color, it would look amazing. The next thing we did is the preparation of the tooth 1, 1, which is the upper right central incisor for veneers. Now veneers, as I'm sure most of you have already heard about, is when there's simply another layer above your teeth that makes your teeth look more new, if you would want to call them that. I definitely don't recommend veneers until you actually need them, because you want to make sure you have your natural tooth structure as long as possible, because veneers or anything you get is never going to be as good as your natural teeth are going to be. So try to keep your natural teeth, but if you really need them, then you can get veneers. Anyway, I'm going off topic. Let's get back into topic. So for veneers, what we needed to do is we only needed to move a slight amount from the vestibular surface of the tooth, and we need to create a border around the edges where the veneer would later be fitted onto. Now at this point you might be wondering, amalgam, composite, what are these two things that they use for filling, and why can't they just decide on one? Well, let me explain. I asked my teacher and he said in the majority of cases we use composite filling, and this is for a few reasons which I'll get into. Back in the day, at least, they used to use amalgam fillings as well, which were really common. The only problem with amalgam fillings is that they have a bad aesthetics. When you get an amalgam filling, it just looks like you have a shiny metal thing on your tooth, so it's very obvious you have gotten a filling. Whereas composite, they have more of a natural tooth color, giving them more of an aesthetic vibe and making them look more like real teeth. Let's go through some of the advantages of amalgam and then the advantages of composite and why you should use one or the other. When it comes to amalgam, the benefits of amalgam are that number one, it is much more cheaper than composite to make and to use as a filling. The second point with amalgam is that it is much stronger than composite. This is obviously because it's made of metal alloy and liquid mercury, so obviously it is going to be very strong. This also means that it has excellent wear resistance, so it will last for a much longer period of time before you'll need to get another amalgam filling, or it might even last for your whole lifetime before you need another filling. You probably will never need another amalgam filling once you have gotten one. And along with that, it is also much easier to be used by the dentist. But the thing is, because amalgam is so strong, if it isn't shaped properly into your occlusion, the amalgam is so strong that the teeth on the opposite side that are occluding with the amalgam filled tooth actually start to be abraded. So you really do not want that in your tooth. So if you are getting an amalgam filling, make sure it's a proper dentist that knows what they are doing. Now, when it comes to composite, the main purpose for using composite is aesthetics, aesthetics, aesthetics. Aesthetics is the biggest point about composite, because finally we are able to restore a broken tooth with something that looks exactly like a tooth and that can't really be differentiated from your natural teeth. Another thing for composite is that, as we talked about preparations for earlier, for composite you need to break down less tooth structure because the walls just need to be parallel. All you need to do, take away the caries and you're done. Fill it with Composite and that is sorted. And this is where Composite takes over Amalgam, because your natural teeth are never going to be beat by any sort of artificial material that you put in there. So Composite allows more of your natural teeth to stay, which is a very good point. Composite is also repairable, so if it is broken, we can just fill the broken space with more Composite and the Composite is fixed once again. And another really good benefit of Composite is that it can be done in one sitting. You go to the dentist, they will check your caries, they will remove the caries, they will fill it with Composite, they'll polish it, you're ready, go home, don't worry about anything else, you are done with your Composite filling. Also, Composite is less affected by temperature. Obviously, Amalgam being a metal, it is more affected by temperature because it's able to conduct heat. Because Composite is not a metal and it's actually considered to be a plastic or an acrylic, it doesn't conduct heat as fast, and thus is more beneficial when it comes to the patient eating or drinking hot or cold foods. The next thing we learned, which was probably one of the most interesting things that we have done in Conservative, is we've done all of these preparations. We've made everything ready. And now it's time for the final step, filling the tooth. So the first thing we need to do to any preparation before we start filling is medicatio cavidentis. What we did in this step is we cleaned the cavity that we had created with 3% hydrogen peroxide and then 70% alcohol. This is also known as an antiseptic. It's basically used to remove any sort of debris or dirt that there is and kill any sort of bacteria that have gotten into the cavity in order to get it clean and ready for the new filling. The next thing we did is we placed amalgam in the following teeth. In the teeth 2-8, 4-8.
This is the maxillary second molar with an amalgam preparation. The amalgam from this part fell off because I kept dropping the tooth, so it just broke.
2-5 and 2-6. The next thing we did is we placed glass ionomer cement, or which is known as GIC, into the natural molar. The good thing about glass ionomer cement as compared to normal composite is that there's no need for any etching or priming to take place. You can just put the glass ionomer cement into the cavity preparation that you have done, and then right after that use UV light to cure it. The next thing we did is we created the restoration for the maxillary first premolar from Composite. So when it comes to Composite filling, there are a few different steps that it needs to go through. The first step is known as etching. This is when we rub some acid onto the surface of the tooth. This acid basically makes the surface more rough, which creates a larger surface area for the future bonds to form. The next step we did is we used a primer on top of the etched surface, and then on top of the primer we were able to add on the Composite. With Composite fillings, the way to get the best results is to add the Composite in different layers, and after each layer use the UV light to cure the Composite, making sure that the Composite has hardened, and then you can begin with the next layer and keep going until you have created all the layers and created the anatomical tooth structure that you need. So that was it for the first semester of conservative dentistry. I found it really interesting, and this semester we're supposed to be doing more endodontic sort of work, working with the pulp and all of that sort of stuff. So I'm excited to see where we go with this subject, because it is truly interesting. I hope you guys enjoyed this video. If you did, be sure to give me a thumbs up right here, and I hope it helped you guys out a lot, especially the low years. If you're coming up here into 30, I know it can be a little bit frustrating, so I hope this helps out a little bit. If you feel like your brain needs a break after all of this studying, then I definitely recommend you check out my fun facts about dentistry video. It was quite a fun video to shoot, to say the least. I enjoyed it a lot, and I had so much fun recording it, and I'm sure you will enjoy watching it. So check it out, it's right over there. But before you go, wait, there's no hurry. Relax. First thing we gotta do, hit the subscribe button, because you already know we are trying to get to 500 subscribers this year, and I'm gonna try uploading as much as I can. My name is Saad. Thank you for watching this video, and I'll see you guys in the next video.